Patients cough for a variety of different reasons, and for anybody that has a cough that is unexplained for more than 5 weeks, then you need to seek a specialist opinion with a pulmonologist or respiratory consultant. The common causes of cough should really be considered in terms of causes from the upper respiratory tract, that's anywhere above the larynx. The lower respiratory tract, that's any area below the larynx. And then of course, need to consider the gastrointestinal tract as well. Teasing out the cause of the cough really requires a very careful clinical assessment, examination, and then targeted investigations. My view is that that can only be done after seeking specialist opinion with a pulmonologist.